Welcome back, everybody. This segment we're going to talk about sort of immunisation again, but lots of the questions that you have about that. So, we've been talking about, is immunisation safe?
Yes. And I guess the short answer is yes. Immunisations are safe. They are thoroughly tested. So the vaccines, before they even get licensed in New Zealand, have gone through a number of different trial processes. They've usually been licensed in other countries before we even get them. Something like the chickenpox vaccine was available for nearly 20 years in the States before we actually had it on our schedule here.
Right.
So well and truly tried and tested. And safety is a key priority for anyone who's involved in immunisation. We're giving vaccines to a fit, healthy population who we want to keep fit and healthy.
Yeah.
So we do actively encourage people to report if there are any concerns that they have, and if people think that there are any events that have occurred that are related to immunisation, we do suggest that they're reported through to CALM.
Yeah. And what does CALM stand for? Because there is a process. So if you do have a child or your own immunisation that you think that you've had a reaction to, there is a process, and it's clearly adhered to and really important that it's followed and followed up.
Yeah, so CALM is the Centre for Adverse Reactions Monitoring, and so they look at vaccines as well as other medicines, and they read through the reports that are often sent in by health professionals, although anyone can report. The advantage of health professionals reporting is we also make sure that they're able to, we can give them the batch numbers of the vaccines that were given, and making sure that the correct site information and all that as well. But anyone can report to CALM, and you usually get a nice little letter back explaining, if it's a common side event, or if it's something that's outside of that.
Right. And if you've taken your child for the immunisation and you think they've had a reaction, it's always best to seek medical advice and assessment for your child at that time, and the doctor would then follow that up.
Yeah. I mean, of course, there are other things, as we discussed before, vaccines are medicines. They do have side effects. So we do expect to see some response, tenderness, redness at the injection site, and usually a mild fever too. So, those are things that we do expect, and hopefully you're given good information and you feel able to manage that after your child's been vaccinated. Yeah. But if you've got any questions, don't hesitate to contact your primary healthcare provider.
Yeah. And the PlunketLine nurses are always getting questions at all hours of the day and night about parents who are concerned about the fact that baby had immunisations today, and we're just worried that the injection site looks a little red, or the fever is starting, or and just wanting to walk through, and we give you an assessment, and we give you a plan. Happy to do it. So look, what about live vaccines? We hear about vaccines that are live. What does that mean?
Okay,
really?
So for some diseases, to get protection, what we need to give people is a weakened version of the virus or the bacteria. So for most vaccines, they're either killed or inactivated, or they're just part of the protein of the bacteria. Whereas with live vaccines, they are basically the whole kit and caboodle, excepting it's weakened. It's really slowly replicates, so that allows the immune system time to go, oh, there's an invader, I need to do something about that, produce an immune response and get rid of it. Now, because there's that whole process there around it being live, even though it's weakened, there are a number of people who can't have live vaccines. And they're usually people who are on immunosuppressive medications, people who are undergoing things like chemotherapy, and there are some immunodeficiency disorders, which also mean that people can't have those live vaccines.
And if you're part of that population, you're going to know that, and you'll be given really good care and advice from your medical practitioner about managing that.
Yeah, and it's certainly something like when you go in to have your immunisations done, whether it's for yourself or for your baby, that is part of the pre-vaccination assessment that the vaccinator will carry out. Yeah.
And so, so we've talked about how they're monitored, they're recorded. You get a record of it in your immunisation, in your book, in your Wild Child book.
Yeah.
So you all need to take your Wild Child book along.
Really please remember it is easier.
The practice nurse will as you say, record the dose and the batch number and, the date and time and things that it was administered, and by whom. So that will be kept on file at your medical, wherever you see your local GP.
And it also goes through, in most cases, to the National Immunisation Register. So really for any child who's been born since 2005, unless they opted off of the register, they'll be on there. Now, there are huge advantages to that in terms of being able to, wherever you are in New Zealand, get access to your immunisation records. We're a population that moves around, and we don't often stick with one general practice. So
you just have to Google National Immunisation Register. You just get a link, and it goes through to your local GHB and tells you how you can find, you know, what your child has had.
And if you contact your general practice, if you've moved and you've got a new general practice, they'll do what's called a status query, which basically means they'll pull that information from the National Register. So, as someone who practiced nursed before 2005 and giving lots of IMS, it has made life so much easier for us adults. Probably you and I, you know, we rely on hopefully the records at our general practice, or in my case, my lost Plunket book. So it's much harder to get those records.
It is,
and slightly older ones.
And it's when you start travelling or want to enrol yourself in study or go to another country for another reason, and you've got to prove an immunisation status. That it becomes really difficult. So our children from 2005 with this register now. It's going to be much easier to retrieve those records should you lose them. Okay. So you know, are they free? Are most of them free?
Yes, most immunisations are free. So if you look at your Well Child book, and you'll see there's a list there of national schedule vaccines and event times. Now, those immunisations are free for all children who live in New Zealand, regardless of their or their parents' immigration status. And that, so by child definition is under 18.
So therefore, you know, no matter what age you are under 18, if you haven't started your immunisation program yet, it is free.
And there are vaccines that are available for people entitled to healthcare in New Zealand who are over the age of 18. And the HPV, or the human papillomavirus vaccine, which is generally given at age 12 or year 8 at school, that's actually funded up until the day you turn 27. So
that's really good. So it doesn't matter if you start that one late. You know, if you come to the table late, it's best to be on time.
It's best to be on time. We want you protected before you are at risk.
So what about for our communities from refugee or migrant families who come to New Zealand and they're not sure about what their protective status is? They may have had immunisations from where they may have lived before. How is that managed once they get here and they may not have a record of what they've had, or they don't know?
Okay, so for refugees who come through the Mangere Resettlement Centre, there's a process there that they go through, and they actually plan a catch-up immunisation schedule for particularly those children who go through the centre. And so they look at a number of different things, including immunisation records from overseas. And so they put together that for people who don't come through that process, they generally, your practice nurse will go through what documentation you do have, and then work out a catch-up schedule. If there's no documentation, then our general advice is that we offer the immunisations again. It's much better to know that you've got protection on board than
be in doubt. Good. So when my child is sick, we get a lot of questions from parents who are saying, I'm worried that my child might be sick, and can they still be immunised? So when are the sort of can or maybe can't times that they, you know, what does sick look like from an immunisation point of view, you know?
Okay, so generally what we're looking for is a child acutely unwell? Have they suddenly become unwell? Are they in that beginning phase of being unwell? And do they have a fever? So for a lot of children, this time of year, lots of sniffles. You know, they're not necessarily a reason not to vaccinate.
So if they've got some sniffles, they've got no fever, they're feeding really well, and they're pretty active if they're mobile, and you know, and they're not grumpy or grizzly and needing a lot more cuddles than normal, then we would say they sound like they're well enough.
And generally, before your child's given their vaccines, they'll have an assessment with the nurse or the vaccinator. It may be the GP who does the vaccinating. They will check that out. And if they're in doubt, they'll do things like check the temperature and just check that that's sitting at under 38. If your child's had like an infection of some sort and they're on antibiotics, but they're actually on the vast improve and they're feeling better, they can be vaccinated while they're still on those antibiotics. That's not a problem. So, you know, if they're in the process of getting better, then we would certainly still vaccinate them. So,
Cool.
yeah.
And, if I've missed a dose, so, we've missed a dose, what do we do? Do we carry on with the one that's due next, or?
Now, that is a really tricky question, and it does vary. So, generally for children under the age of 12 months, it really would be a case of, yep, let's just give the next dose, with the exception of rotavirus vaccine, because that has very tight time frames for when it needs to be given. But if a child is more than 30 days overdue, then the vaccinator will just go through and just check the timing, because we can shorten some of those gaps when a child is overdue. So the minimum gap between the immunisations on a catch-up program is around 4 weeks.
Right. Okay.
So yeah, there's a little bit of work that goes on in the background if you're catching up. But
yeah, seek the advice, and your practice nurses are really good first protocol around timing. Okay. And if I'm travelling overseas with my child at the moment, what do I need to be thinking about doing?
There's probably a lot of things in that question. So there are a number of countries around the world where measles is a particular problem. So thinking about things like, does my child need measles, mumps and rubella vaccine before I go? How old are they now? They're also thinking about things like, are you going to be able to access clean water? Taking lots of hand sanitizer all the way. Not on immunisation so much, but yeah, definitely the hand sanitizer. And just making sure they're up to date with their IMS before they go. Consulting with a travel doctor if you're going somewhere just even that little bit exotic, and just thinking about, are there vaccines that they can be given? A lot of the travel vaccines can't be given under the age of 1 year. So,
and then a lot of parents ask, well, if I can have it, why can't my child?
Yeah, and some of that is an arbitrary line in the sand of, this is when the vaccine was trialled, this is where we've got the information.
This is when
we know it's safe to give, and it's also for some of them working, they don't necessarily have a junior version. They don't have a version for children, because there are slight differences in the antigen makeup of infant and older people vaccines. Right. Yeah.
So when is the flu injection free? That's, that's another question that's come through.
Okay, so from the 1st of April, so 1st of April was beginning last month, through to the 31st of December.
Perfect. So for everybody out there who needs one, good idea to get it on board.
And one of the particular groups that making sure it was funded through until the 31st of December is actually making sure that pregnant women have the opportunity to have a flu vaccine and during the time that they're pregnant.
So it's one of those things that you can have when you're pregnant, and it's really important.
Recommended and funded.
Recommended and funded. And yes, now can I take my 5-month-old to get his immunisations if he has the flu?
An interesting question. Lots of things are called the flu, if a child's got true influenza, they will have a fever, they will be acutely unwell. So no, we wouldn't immunise them. But if a child is that unwell, I generally recommend they get an assessment anyway.
A doctor's assessment, don't they?
So, but if, as we said before, if they've got the sniffles, if they're just a little bit under the weather, then it's probably fine to vaccinate them. But again, that'll be assessed by the vaccinator.
Yeah. Cool. So look, we're going to be back in about 22. We're going to look at the practical tips. So when I take my child along for immunisation, and what to prepare for beforehand and what to think about during and after. So we'll talk about that when we come back, and we're looking forward to your questions. More of them keep coming. They're good. So see you soon.
See you.